And okay, so our next understanding and application of that is the hormone leptin, which is secreted by fat tissue and acts on the brain in a normal sense to inhibit hunger. So, what does it do? All right, it's produced by fat tissue, all right, secreted by fat tissue and regulates the amount of fat that is stored. And also, along with that, it suppresses appetite to increase metabolism. Now these three blurbs here is if it works correctly. So again, leptin produced by fat tissue acts on the brain to inhibit appetite and increase body metabolism to burn fat. All right. Now there you can see we'll get to the mice. That's a fatty mouse. Now the understanding that goes along with this is to understand that the fact that overeating causes more fat cells to be formed, hence more leptin is produced, and thereby suppressing hunger further. Now, conversely, people who are starving leads to a reduction of fat tissue, hence less leptin is released, triggering hunger. And as obese people are constantly producing higher levels of leptin, their bodies become progressively desensitized to it. So in a sense there, you become desensitized to leptin, all right? And leptin resistance also, unfortunately, develops with age. So there's the middle age spread. But the understanding has to do with testing of leptin on people with clinical obesity and really the reasons why it didn't work. So what do we have so far before I describe the experiment for you? Okay, clinical obesity, as you know, is anyone with a diagnosed BMI of over 30. What does it do? Okay, generally patients who have more fat have higher levels of leptin in the blood plasma. Now remember, since leptin is supposed to inhibit appetite, it seems to work opposite in here because their receptor cells in the hypothalamus become desensitized to the increased leptin. So they don't get the reaction that they should. All right, so there we go. And so let's go over, and you can come back to this one, you can keep it up because it's on the PowerPoint. All right, let's take a look at what they did. All right, so leptin trials were initially conducted by actually surgically fusing the blood of an obese and a healthy mouse. It's called parabiosis. The experiment was conducted using mice that were either obese due to a leptin defect, okay, or a receptor defect. Okay, so a mutation in the gene or a leptin receptor. So basically your type 1 and your type 2 diabetes, if it was diabetes in fact, which it's not. Okay, so when the obese mouse with no leptin was fused with a healthy mouse, the obese mouse began to lose weight. Take a look at the little cute little mouse right here, began to lose weight, demonstrating the potential viability of using leptin as a treatment. However, when the obese mouse with the defective leptin receptor was also fused with a healthy mouse, leptin was transferred to the healthy mouse. The mouse began to overproduce leptin to compensate for lower receptor sensitivity. The obese mouse became fatter and it didn't respond. And take a look at the healthy mouse, because the healthy mouse actually became emaciated because of abnormally high leptin levels transferred into its bloodstream. So the experiments were considered not